Every weekday, we're continuing our effort to fight fear with facts as the coronavirus pandemic continues to impact communities across the globe. Infectious disease expert Dr. Ruth Berggren from the Long School at UT Health San Antonio is back with us this week to help us get answers to your coronavirus questions. Dr. Berggren, thank you for joining us as you do on every Tuesday. I appreciate it. Today, Governor Abbott announced plans to reopen hair salons, nail salons, swimming pools, gyms, exercise facilities. Are we ready for all that?
So, Steve, I want to remind everybody that the way we assess how risky a particular enterprise or business is has to do with the contact intensity, meaning how close are you to other people and for what duration? Are you real close and for a long time or not so much? The second parameter is how many people are you exposed to in a particular environment? Is it many or few? And then the third thing is how modifiable is this environment? Can you fix it by spacing it out between barber chairs, for instance. So by those parameters, Steve, if you compare salons to restaurants, they both come out to be about medium risk. And that's kind of interesting. You have more people that you might get exposed to in a restaurant than a salon, but you have less intensity there. And so at the end of the day, restaurants and salons are not especially different by the criteria that we apply from an infectious disease standpoint. Now, all that is to say, you still have to pay attention to the physical distancing guidelines and modify the environment where possible. Don't let 50 people into your barber shop, right? Space the chairs out so there's 6 feet in between people. Have folks wear masks. Do your surface cleansing. Make sure that high-touch surface areas are getting cleansed regularly. And if those things can be done, whether it's a barber shop or a gym, then that modified risk is probably in the medium range, which is similar to restaurants. I hope that makes some sense.
It does, but from your medical experience and your medical opinion, would you prefer we waited a few more weeks?
I would, because I'm going to take us back to those progress indicators that we talked about last week when our health transition team put out our report. And remember that we wanted to see a 14-day decline in new cases. We wanted to see a healthy, unstressed healthcare system. Arguably, we may have both of those. It depends on how you want to count new cases. Okay. But the other two parameters, do we have a contact tracing team ready to go? Nope. We need 175 contact tracers ready to go. And do we have enough tests? Can we test 30,000 people a week in San Antonio? No, we cannot. We can test about 1,600. Now, a week from now could be a very different story. I know that we're going to have increased capacity at University Hospital. But, Steve, we've got 3,000 people in the jail, and it's taking us weeks to test that population. So we're very far away from being able to test 3,000 people in our community. Therefore, we never really have met the phase 2 progress indicators. So I worry about all of these places opening up by those measures.
Right. Okay. And I've got a jail question coming up for you, but the next viewer question is, how often are medical workers, I'm assuming the frontline medical workers, getting tested for COVID-19?
Okay, so remember, this will change as our testing capacity increases, and it may change starting in the next 1 to 2 weeks. But right now, the medical workers that get tested are folks that are providing care, face-to-face care in long-term care facilities like nursing homes where there has been a case. So it's now a recommendation that in congregate settings like nursing homes, like homeless shelters, that there should be universal testing of both the people who live there and the people who are providing the care there, so that you can segregate the positives from the negatives. And in some cases, we have the possibility of not ill but COVID positive healthcare workers still going to work if it's a crisis situation, but cohorting them to where they're working only with positives.
Right.
Does that make sense?
Yeah, absolutely, because you're not going to infect somebody if they already have the infection.
Okay. The other group of healthcare workers that would be priority for testing would be those that know they've been exposed and who work face to face with highly immunocompromised patients, such as, a transplant surgeon or a bone marrow transplanter. If that bone marrow transplanter's kid is home with a fever and you think it's COVID, then it's a really good idea to prioritize that kind of asymptomatic health worker for testing so that you protect all the folks that individual may expose.
Right. In what situation, this is a big controversy now because there are a lot of people offering antibody tests. In what situations should I get an antibody test? Are there any situations where it would be counterproductive?
Yeah, so great question and timely question, and everybody's buzzing about antibodies because there's tons of tests from a bunch of different companies. And please know that in several weeks and several months, my answer will change because we're going to have more information. But today, from where we stand here in San Antonio, it is very likely that a positive test is no better than a coin toss in telling you whether you have a true positive or whether you have a false positive. And the reason that could be bad is that if it changes your behavior, so you now think, hey, I'm invincible, I have antibodies, I'm not going to get sick, and you go around and aren't careful, then you could get sick because it could have been a false positive. We also don't know, even if those antibodies are true positives and if they are protective, we don't know how long that protection may last. So again, the danger is that it could cause people to throw caution to the wind when they should still be very careful. Now, where should we be doing the antibody testing? There's one circumstance where I fully endorse it and we need to do it, and that is for looking for convalescent plasma. People who have recovered from COVID-19 may have antibodies at a very high level that could help someone else get over the disease who's critically ill. And there are protocols in place that allow us to take blood from a recovered person, separate the cells out from the liquid part, and in the liquid part are those antibodies, which are proteins, and we can give them to certain other people who are suffering from COVID. If you don't measure for antibodies, you won't know whether you're giving the right kind of plasma to a sick person. So in those instances, yes, we need the antibody test, but it will come to pass. I'm predicting it will come to pass that we will get to the point where we understand what the overall prevalence of the disease is in San Antonio or in our community, and therefore we'll have a better way to tell you if you have a positive, what's the likelihood that that really means that you had the disease. That's going to happen, and then we are eventually going to know how long those antibodies last and whether they really protect you. From the SARS epidemic from back in 2003, 2004, it turned out that antibodies did develop and they were protective, and those antibodies lasted about 2 to 3 years. So we could hope that that will be the case for COVID-19, but we don't know it today.
Right. We don't know it yet. We're getting there, hopefully. Yeah. All right. Next question has to do with the jail. The county judge today said that 217 of 294 inmates at the jail tested positive and that they were asymptomatic. What does that tell us about the coronavirus?
So there's a couple of things, and I want to make a point, which is that an asymptomatic person may also be a pre-symptomatic person. In other words, I could do the test on you today, you don't feel anything and you're fine, your test comes back positive, but if I monitor you closely, you could become symptomatic anytime, ostensibly in the next 14 days, more likely sooner than that. But asymptomatics could also be pre-symptomatic, and we will have that data eventually from the jail because we're monitoring people for symptoms twice daily. Now back to your question, what does this mean for coronavirus? What does it tell us? It tells us that really a large proportion of people, I'm going to avoid giving you a percentage number, but a large proportion of people who get the virus are going to have such mild disease that they're not even going to notice it, or they're not going to think it's worth writing home about or going to get a test for. Yet, those are the folks who may be able to transmit it to others. That's the whole point of why we want people to mask, is because we know that we may have the virus and barely notice the symptoms, and yet the potential for transmission to others when we're barely symptomatic exists. How do we know this? We know this from studies that have been done in China, and there's some very credible reports that do include some mathematical models that are coming out of Wuhan, China, and other places that really do show us how important these undocumented infections are. Undocumented means we didn't go get a test because the symptoms were either mild or absent. So undocumented people clearly can transmit.
All right, last question from the viewer for you. Why should the average person care about what's going on in the Bexar County Jail? We get the numbers every day, and I think a lot of people think the jail is separate. The jail is another thing. It's not, we're not talking about community spread. Why should the average person care about what's going on there?
We should care a lot because it's right in the middle of our city. And there's a lot of people coming in and going out of the jail every day. There is SARS-CoV-2, the virus that causes the COVID-19 disease. It is present in the jail. You heard already the numbers today. I won't repeat them, but we have quite a lot of people there. There are people who are negative, and slightly more are negative than positive from the ones we've tested so far. And that's good because we can keep them separate. But in the meantime, the jail is a place where there is SARS-CoV-2. Workers who work in the jail, about 550 of them, they come from the community, they go into the jail, they go back home. We're in the process of testing them as well. And as you know, and has been reported, there have been a number of deputies that have been positive. Then we have people who continue to be brought into the jail as potential inmates, a lot of them. In a city this size, we have 50 to 70 or 80 people who may come in, be brought in to be detained, and then we have close to that many that are going out every day because they serve their time, or they get reevaluated and then they get bailed out. Okay, so you have this constant coming in and going out of the inmate population as well as the worker population, and that means every time somebody goes out of the jail, they could be bringing the virus to others in the community. So we're not done yet, and we need to get this contained. And as long as we don't get it contained, we have the risk of spread.
Dr. Ruth Berggren, UT Health San Antonio, I appreciate your time. Thank you.
Happy to be here.
We'll be right back.